Okay, I have to zoom forward here just a second. And we are looking at a panoramic film on a child, so a pediatric patient. And I want you to look at this image and see if you can determine how old the patient is. So we were going to look at a few things here. Okay, so we want to look at things like what teeth have already erupted in the mouth. So if we look at this molar and this molar, this molar and this molar, we know that those are the 6-year molars because here we see little molars next to this big molar. And you can see how much longer these roots are. They're not totally done forming, but already you can see the size difference of this one in comparison to the size difference of this. So we know that these are permanent molars, plus there's nothing behind. They've already shed the baby and this is the adult. So these are the 6-year molars. So we know that the patient's got to be at least 6. And then the central and central maxillary and mandibular incisors are in, and there's no teeth coming behind, so those have fully erupted. So again, that's 6 or 7. And then the laterals are somewhere in the 7 to 8 range. But then we notice that the 12-year molars are obviously still in the bone getting formed, so they're certainly not 12 yet. And then the premolars and the canines as well. The canines tend to come up sometime around the 10-year mark. 10 to 12, it just depends. But so it's safe to say that this patient is probably somewhere in the 8 to 9 year range. They're probably not 10 because of the canines, but they're probably older than, say, definitely, I would say older than 7, but less than 10. So we can just guess and say they're probably 8 or 9 years old. But you can see that when you take a pano on a pediatric patient, you have a wonderful view of the development. You can see how teeth are starting to position, what teeth are coming in, if something's congenitally missing. So it gives you a lot of information. Okay, we're going to talk about anatomy next and some of the basic concepts in anatomy. We want to understand density changes. So this can be a little bit confusing, and I have to admit, even when I've looked at a ton of panos online, and it still sometimes doesn't totally ring true to me. I don't plan on testing you very heavily on this concept, but in general, air obscures hard tissue. So a perfect example of that is if the patient leaves, and we'll show you images of this, but if a patient does not put their tongue to the roof of the mouth, we're going to obscure the apices of the teeth. So air spaces tends to obscure hard tissue. Soft tissue tends to obscure air spaces. So we'll see the soft palate over the glossopharyngeal air space or something like that. Hard tissue obscures soft tissue because it's more dense, and then a ghost image will obscure everything because typically, not always, but typically a ghost image is metal a lot of times. Okay, so let's see, as we go over to this slide, we're going to start to try and envision some of these structures. So along the top of the apices of the maxillary teeth, oftentimes we're going to see that palatoglossal air space. That's what we're going to want to try and close down by putting the tongue to the roof of the mouth. Off to the side, we can see kind of a divided line of the nasopharyngeal airspace, and then as it follows it down into the oropharyngeal airspace, or the book calls this the glossopharyngeal airspace. I think that's intertwined because I'm not seeing, in the book I see glossal, but I can see oro in some other writings, but I think they're the same airspace. Here we can see, again, the palatoglossal airspace is this dark space right up here. It's pretty thin, so they did a good job of keeping their tongue to the roof of their mouth. And then we also can see the greenish areas are the nasopharyngeal, here and here, these two lines or two tubes or whatever we want to call them, and then it comes down into the glossopharyngeal down here. Okay, so some more air spaces. Again, we see the palatoglossal airspace up here. And then we see the nasopharyngeal airspace here, and it almost looks like it'd be there and there. And then the oropharyngeal or the glossopharyngeal down here. And if you can see, do you see how this is the neck of, we have the condyle and the neck of the condyle here? And you see how the airspace going over that hard structure of the bone lightens it? That's an example of the airspace obscuring hard tissue. So airspace has a tendency to make hard tissue look less dense or obscure it altogether. So some more anatomy. So here we have the tongue. The tongue is kind of divided into two because remember we're taking images as we go around the back of the head. So sometimes you get, this is your real double image. So you get a real double image of the tongue, and then the soft palate and the uvula up above the tongue. And sometimes it seems like it's coming way down when I look at some panos. And then 3 would be the lip line. Sometimes you can see a little bit of a lip line there. And then 4, the lobes of the ear. So you can see, actually sometimes see their earlobes, or sometimes you can see a very clear outline of their entire ear. But you'll see their earlobes. So here is sort of an example of those. We can see this, I kind of feel like this doesn't show it very well because of the green, but in general the tongue is coming over here, the soft palate is coming over here, and then an earlobe would be somewhere in this range. I think we have some better pictures coming up. So here you can kind of see an earlobe. This one is not as clear again. Number 2, soft palate and the uvula, so this kind of whiter space in between the air space. Here we have the air space, but then the whitish area is the soft palate and the uvula. And then the arrows here is the dorsum of the tongue. So this kind of whitish area that comes across here like this is the tongue. So hard tissue obscures soft tissue. So then that's showing how the teeth, which are the hard tissue, is kind of obscuring the vision of the soft tissue, which is the tongue. So here's some more ghost images. So a lot of times we'll see, a lot of times when we think of ghost images, we think of something metal. But a ghost image can also be the spine or the angle of the mandible. So here, where's my mouse? Here we have this blue section here, and then here. This is the contralateral side of the mandible. So this is this area here. This angle of the mandible has a ghost image over here. So it's the opposite side of the mouth. It's higher up and it's going to be blurry. So this will all be blurry. And then this blue space here is this angle of the mandible. Opposite side, higher up, and it's going to be blurry. And then we see a ghost image of the cervical spine. So the spine, we see the real double image here and here. And then we see the ghost image toward the center, toward the midline. It's going to be blurry. It's going to be larger, and it kind of gets in the way of our images sometimes. It depends on how the patient is positioned. Sometimes it's better depending on if they're standing up nice and tall. So here we kind of have an example of that again. You can kind of see it right here too on this side. But here we have the ghost image of this border of the mandible here, and then the cervical spine. So ghost images obscure everything. So if you have a real prominent spine in the center, it's going to obscure your teeth. So here's another image of it. Here's this angle of the mandible is over here. So it's the opposite side. It's blurry and kind of larger. And then through the center you have this cervical spine. Okay. I'm just going to put a break in here because it says to, but I can't play a game with you. I'm sorry. I wish we could.